Wednesday, and that means we are diving into topics for an overall better healthy living. October is Breast Cancer Awareness Month, and here to share more about the importance of the issue is Dr. Ahn Lee with Las Palmas del Sol Healthcare. Thank you so much for joining us, Doctor.
Thank you for having me.
Well, breast cancer is something that I believe affects many of us, whether directly or indirectly.
So 1 in 8 women will be diagnosed with breast cancer in their lifetime, so this is an important month to get awareness out there.
How important is it to get a mammogram to avoid that late diagnosis?
It's very important. A woman should be getting her mammogram annually, especially after the age of 40. Younger if she has a family member that's been diagnosed earlier.
What are some of those risk factors associated with breast cancer?
So there are many risk factors, but in general, if they have a family history of breast cancer, medical problems such as obesity, smoking can also increase your risk of breast cancer.
And what are some of the early signs and symptoms of breast cancer?
So women usually will, if they do a monthly self-breast exam, which I highly advocate, they can feel a little lump or a bump in their breast or underneath their armpit. So it's very important to check there. They can see changes in their skin or their nipple, or they can have some discharge, but oftentimes they don't have any signs or symptoms, and it's where the mammogram comes in to detect if there's anything in the breast.
And thankfully, we are very advanced in medicine that even if someone is diagnosed, there are different treatments available. Can you talk about those?
So I'm an advocate for telling patients that there are many options available to them. It's just not a one-stop shop, so they have to be aware of what their options are. Research, educate yourself, because there's, advances in technology now that are able to help women, regain normalcy after a breast cancer diagnosis.
Tell us more about the surgery that you specialize in.
So I specialize in the DEEP, or the DIEP flap breast reconstruction surgery, which is taking skin and fat and transplanting it up to the chest to build the breast. And so it's a very highly technical surgery that I perform, and I love performing it. You have to love it to do it because it's a long surgery, and it's an actual transplantation. Just like a kidney transplant or heart transplant, I'm transplanting fat to rebuild the breast.
I'm glad to hear that we have that here in El Paso. And I think it's important to note also that this not only impacts women, but men as well.
Sure. So again, if they have any kind of family history, also any kind of genetic diseases in their family, the men definitely want to get checked out.
Alrighty, thank you so much for joining us, Doctor. And with this Breast Cancer Awareness Month, I think it is very important. I myself have unfortunately lost loved ones to breast cancer. So definitely get those mammograms, and again, be informed. This October being Breast Cancer Awareness Month. Thank you so much for joining us, Doctor. We'll be right back.